Hi, Hanny. How are you?
Pretty good. How are you?
Good, good. My name is Amber. I'm the RN here. Nice to meet you.
Pleasure's all mine.
Thank you. So I spoke with Dr. Hofstadter, and she told me she'd like to start you on Xanax. Is that true?
That's correct, I believe. Yeah.
Okay. So I'm just going to educate you more in detail about what anxiety is, why she's giving this medication to you, side effects, and some things that you need to avoid.
Okay.
First, I need to review your chart. Okay. It looks like your only other medications are citalopram 10 milligrams,
That's
a
correct,
multivitamin.
yeah.
You don't have any allergies to any medications.
No.
And then it looks like no history of lung, kidney, or liver disease, no brain disorders. You don't drink alcohol, but it looks like you do smoke hookah. Okay, is that true?
Yes.
Okay, the PHQ, which is the depression questionnaire, shows that your depression is well managed with your citalopram. And then the GAD shows you do have some moderate to severe anxiety. Does that feel true to you?
Well, I believe so, yeah. I just got a new job and have a baby on the way, and my wife decided to essentially stay at home. So sometimes, it keeps me worried and like up all night thinking about finances and stuff like that, and I sometimes overwhelm myself. So, yeah.
Yeah, those are some anxiety symptoms. And then some other ones you would notice, like if it were severe anxiety or you were going to have a panic attack, are heart palpitations, or your heart rate gets faster, or sweating, shaking, shortness of breath, trembling, feeling like you're being smothered, impending doom, and feeling out of control. Have you had any of these symptoms?
Some of them, yeah. In general, like I find myself in some situations getting more irritable than normal, having trouble concentrating, can't sleep up all night, and just anxious. Yeah, it's different.
Okay. So these symptoms of a panic attack, it can happen suddenly, it can be unexpected or triggered, and then it'll peak in a few minutes, and we don't want your anxiety to come to that. In that state, your perceptions are impaired of what's going on around you, and then your problem-solving skills are impaired, and then it can lead to dysfunctional behavior and relationship issues. So Dr. Hofstadter has prescribed Xanax or alprazolam, 0.5 milligram tab, to take either a half a tab or a full tab.
Okay.
As needed for anxiety, but up to 3 times a day.
Okay.
This is for short-term anxiety use for you, and you'll take it when you're noticing these feelings of anxiety, and then you'll notice the symptoms are they lessen within 5 to 10 minutes, and then after the medication, the peak effect is 1 to 2 hours.
Okay.
Also, it can be used in other cases for insomnia, agitation, seizures, and severe grief and panic. It's classed as a benzodiazepine. It helps relieve anxiety, and it takes effect more quickly than a depression medication that's prescribed for anxiety. If you find that you're needing Xanax more often or long term, the doctor may switch you to another medication.
Okay.
If this medication is taken frequently, you can build up a tolerance, and it could cause you to potentially become dependent. It's a controlled medication due to its anti-anxiety and sedative effects, as well as its addictive potential. So,
Okay. I don't want that.
so that's why it's a controlled substance. Do you want to know how it works?
Yeah, it's too much. Can you please
Okay,
elaborate
yeah.
how it kicks in, how it works?
So what it does is it decreases your fight or flight responses, which is in your central nervous system. It lowers your norepinephrine and dopamine neurotransmitters. and then it decreases the anxiety in the limbic system in the brain by enhancing GABA.
GABA? What is that?
Oh, it's the neurotransmitters, which they control emotion, mood, instincts, and drives, such as like hunger, care of your offspring, things like that. But it helps slow things down and helps you relax. Some side effects that may happen are increased heart rate, decreased blood pressure, decreased respirations, drowsiness, sedation, dizziness, fainting, depression, headache, confusion, insomnia, clumsiness, hallucinations, and paradoxical excitement, which is when the drug backfires and the symptoms are worse, such as like rigidity and restlessness. And then some so this medication does not interfere with your citalopram, but some interactions that you do want to know is not to take alcohol, which that's not a problem for you, it seems like. Also avoid anti-seizure medications and tricyclic antidepressants, which you're not taking either one of those, but you'll want to avoid antihistamines such as sleep aids, cold and hay fever medications, and allergy remedies.
Okay.
And then also you want to avoid kava, some herbal supplements, kava, valerian, and St. John's wort. And then an interesting fact that is beneficial for you to know is that you want to avoid smoking while taking this medication because it decreases the effect by 50%. So it's not going to help you. And then some other random things to keep in mind are to make sure you're changing position slowly as it causes dizziness and fainting. Don't avoid the medications on the list that I gave you, which I'll have a copy for you. Don't drive, operate heavy machinery, or participate in any potentially dangerous activities while taking this medication, or until you know that the effect is at a normal level. Avoid grapefruit juice, and then taper the medication. If you do happen to take it frequently and you withdraw, you stop, and you might have some withdrawal symptoms such as nausea, vomiting, abdominal muscle cramps, sweating, confusion, tremors, and convulsions.
That's a lot to remember.
I'm going to print out a copy of you with all of the side effects,
Thank you. Appreciate it.
Just the side effects, things to avoid, the education points that I pointed out, as well as the signs and symptoms of anxiety, because some of them you might not notice that this is a symptom, but it is. And then I do think it would be helpful for you to log your episodes of anxiety. There might be some trends and correlations that if we look at it on paper, we'll be able to see, like, this is when it's going on. Like, is it at work? Is it before a meeting? Is it at night? When are these things happening? What's triggering it? And then we could potentially discuss cognitive behavioral therapy, which is, it teaches you different ways of thinking, behaving, and reacting to situations that cause anxiety. Do you have any questions for me?
Not really. Thank you for printing this out. That would be very helpful.
Of course. And just for follow-up, the doctor is giving you 15 pills. You can take a half a tab, but up to a full tab 3 times a day as needed for anxiety. If you notice as you're taking it that the half tab isn't working, it's okay that you take a full tab, but just start out with the half a tab first.
Absolutely.
Because you are going to build a tolerance. That's what happens. Also, we're going to just talk about how frequently you needed it. Well, we would like you to come up with the log, write a log.
I'll write everything down. Yes.
So then we can review when you need it, any possible changes, if you need any refills, And there won't be any refills at the pharmacy because this is a controlled substance. When
Okay,
you get
yeah.
this medication, it'll be written and you'll carry it, and that's it.
Okay.
And even if you feel like you don't need it down the road, it'll expire after 6 months. So just to keep that in mind.
Okay.
Um,
I'm planning a follow-ups. Yeah, absolutely. Yeah, cool.
so we'll schedule that appointment for you.
Absolutely. Thank you so much for your help.
What about a month from today? Does that work?
That works great.
Okay. Here's
Preferably-
a card for you.
All right, thank you.
It was
Appreciate
so nice meeting you.
Very nice to meet you.